Hello and welcome to the session on Pico. My name is Maha Kumaran and I'm the Nursing Liaison Librarian. The objectives of the class today are to talk about the steps involved in the research process. We will look at Pico, what it is, and how it'll help you focus your research question. I will show you other models that are also available to create a research question. We will go through some examples so you understand how to apply Pico for your own research question. In the following video, we will use Pico question and do an actual search on Medline. What are the steps involved in research? Research is a reiterative process. You might have an idea, do a quick literature search on the topic, and decide that there's not much on the topic. Or there may be a lot on the topic and you might have to find a niche for yourself. Once you find what your research area is going to be, which will be a broad topic, you will want to narrow down your research question. This is where Pico will be handy. The next step is to identify resources. Most of the nursing resources you need are available through the Nursing Research Guide at libguides.usask.ca/nursing. Click on the Articles and Databases tab to find the list of databases that are relevant to nursing. Then, perform your search. We will do this in the next video. Save and organize your results. Validate your results. On the same LibGuides page, click on Evidence-Based Practice Resources tab. Under Critical Appraisal Tools box, there are a list of resources you can use to appraise your results. Analyze and interpret your results, and present your results. When you do your research, you will find that you're interested in a broad topic or a scenario. You need to use Pico, a mnemonic, to formulate a proper research question. So what is Pico? It's a mnemonic that reminds you of the most important concepts to remember when phrasing a question. P in Pico stands for patient, problem, and population. I stands for intervention, C for comparison to the intervention, and O for the outcome that you're evaluating. As I mentioned, there are other models as well. PCOT with one T, where the T could be about the time frame involved in the research. Maybe you're following smokers for 6 months. Maybe you are evaluating the bonding that happens between new mothers and their babies for the first month. PCOT with two T's, where one T could be the time frame and the second T could be the type of study you're looking for. Maybe you only want RCTs, or quantitative studies. SPICE is another model you can also use, where S stands for setting, P for perspective, I for intervention, C for comparison, and E for evaluation. In SPIDER, S stands for sample, PI for phenomenon of interest, D for design, E for evaluation, and R for research type. They're all very similar but different. In SPICE, S could be the setting, and the setting could be a school, a hospital, or a long-term care facility. P could be the patient, or from whose perspective the situation is being examined. I is the therapy that's being assessed or advised to the patient, and C could be the alternative to the intervention. Evaluation is the outcome you're looking for. In SPIDER, S is the sample or the population group. The phenomenon of interest is how and why certain behaviors, decisions happen. D is the design of the study, the framework that supports the study, the research methods that were used. E is the outcome measures. They may be observable outcome measures, could be subjective, could be attitudes, beliefs, opinions, or feelings. Research type generally denotes either quantitative, qualitative, or mixed methods research type. Pico is most commonly used to design a research question. Let's go through a few examples and see how to use Pico. Here's a scenario. Remember, your topic will always be broad, or the scenario will be broad. Then you need to apply Pico to narrow down so you have a good research question. This is a scenario. A 55-year-old female has just come into the hospital and she has been diagnosed with blood pressure. She exercises and eats right. You need to decide with your team whether she needs to be on beta blockers or ACE inhibitors. Who is the patient in the scenario, or what is the P? 55-year-old female with high blood pressure is the P. Remember to capture all the information about your patient: their age, gender, race, and the problem they are facing. The intervention you want to introduce is beta blocker, and you want to compare it to ACE inhibitor. The I and C in this situation are interchangeable. O, the outcome, is you're looking for symptom reliefs or to keep the blood pressure under control. This is what your Pico would look like. Now use the elements of the Pico to formulate a proper research question. In 55-year-old females with high blood pressure, are beta blockers more effective than ACE inhibitors in controlling high blood pressure? This is what your research question would look like. Let's do another example. Your patient is an African American postmenopausal woman who is wondering if she should undergo HRT to improve urinary incontinence. The P in this case is the African American postmenopausal woman. The intervention she's looking for is HRT. We don't have anything to compare it with. The outcome she's looking for is improving urinary incontinence. Once again, use the Pico elements to formulate a proper research question. In African American postmenopausal women, would HRT help in improving urinary incontinence? One more example. You're working in a pediatric department. A parent with her 3-year-old child is concerned about giving her daughter the MMR vaccine. A couple of her friends' kids who had MMR vaccine ended up with febrile convulsions. Who is the P? You will be right if you said pediatric patients who are due for MMR vaccinations. You will also be right if you said parents of pediatric patients who are due for MMR vaccinations. The intervention here is the MMR vaccine. There is no comparison, and the outcomes we are looking to prevent are seizures and fever. Now use the Pico elements to formulate your question. Does MMR vaccine cause seizures and fevers in pediatric patients? You need to find this information so you can give that to the mother. Another example. You just helped stitch up a patient's knee laceration. You saw that he was clearly stressed, anxious, and in pain. You had read somewhere that music would relax patients in such situations. You want to look for evidence to see if psychological stress in patients can be prevented or reduced with the use of music therapy when they are undergoing treatments for their wounds. Clearly, your patients are patients with lacerations or wounds who are also stressed, anxious, and in pain. The intervention is music therapy. You're not looking for any comparison. You could say what would happen if there was no music therapy. The outcome is to reduce stress and anxiety. Using the Pico elements, if you formulate the question, this is what it would look like. In patients undergoing treatments for wounds, would music therapy help reduce their anxiety or psychological stress? Once you formulate a Pico question, the next step is to identify the most important concepts in your question, the concepts that you will actually search for. In this question, You would look for information on wounds, music therapy, anxiety, and stress. In the next video, we will look into how to search Medline. Here's my contact information. Feel free to contact me anytime if you have questions or need help with formulating your own question or need to find resources at the library. Thank you for watching.